Carolyn Vickery bears the scars of her brush with death and her experience with Ambulance Victoria.
Basically sort of found her, unable to lift her head off the bed.
The Orbost mother suffered a brain bleed caused by an aneurysm in August. Her brother, a Melbourne GP, was nearby at the time.
I thought she was basically having a catastrophic intracerebral event and was basically, dying in front of me.
At 12 minutes past midnight, Dr Adams called 000. At 12:24, Carolyn had lost consciousness, and so Dr Adams dialled 000 again. It wasn't until 12:29, 17 minutes after the first call, that an ambulance was dispatched. The nearest available was in Mallacoota, an hour and 45-minute drive away. At around 3 a.m, the ambulance finally arrived, nearly 3 hours after the first 000 call.
She was incredibly lucky that I was home that weekend and that she had a GP as a brother.
Her son is also a New South Wales paramedic.
Given kind of the symptoms that she was displaying and described over the phone, she definitely should have got a lights and sirens response.
At that time, Code 1 ambulance call-outs in that part of the state were at the slowest they'd been in a year. Between July and September in East Gippsland, paramedics reached patients on time in just 48% of cases. Ambulance Victoria's aim is to reach those urgent cases within a quarter of an hour, 85% of the time. New Ambulance Victoria data has revealed just 2/3 of patients were reached within the 15-minute target time.
A lot of aspects of the system are broken, and it sometimes makes me think, do I want to keep working in health? But I guess you just have to keep going, because the alternative, to abandon the system and have it collapse even more is unthinkable, I guess.
After 10 weeks in hospital, Ms Vickery is now continuing her recovery at home.
I just hope by speaking out we can kind of prevent this happening again to another family, who doesn't have the same kind of medical background as us.
Nicole Asher, ABC News, Melbourne.